You or a loved one has been diagnosed with multiple sclerosis. There are challenges that you can face and things you should know to help manage your symptoms. Dr. James Stark, a neurologist at the International Multiple Sclerosis Management Practice, is here to shed some light on this disease. So great to have you here on Be Well.
Well, thanks for having me.
First up, I do feel like there has been a little bit more education. We have celebrities talking about this. But for those who might not know, just explain what multiple sclerosis is.
Sure. Multiple sclerosis is in the family of autoimmune diseases in which the immune system of the body is attacking something in the body that thinks it's not supposed to be there. And in the case of multiple sclerosis, it's attacking the insulation on nerves in the brain and spinal cord, and we call that insulation myelin. It's found throughout the brain and spinal cord, so it can affect different symptoms can come up with multiple sclerosis attacks. But we don't know the cause of it, but we know that that's what was being affected.
And we know there, is treatment, but we obviously want to know, okay, what are the signs that we need to watch out for if we have this? So what are the signs and symptoms?
Sure. Again, because multiple sclerosis can affect almost any part of the brain and spinal cord, there are a number of different neurologic symptoms that can appear. The most common ones, though, would be blurred vision in one eye, possibly with pain in the eye, double vision, weakness or numbness on one side of the body or the other, balance problems. And really the timing is important for these things because anyone will have some numbness if they sort of sleep on their arm funny, and any transient symptoms like that are not the presentation of multiple sclerosis. It's really symptoms that can begin over a few days and then last for at least a few days, even to a few weeks.
Who's more likely to, develop MS?
MS affects women 3 to 4 times more than men. It's nice to shed a spotlight on some of these less common diseases that disproportionately affect women. It generally starts in your 20s and is a chronic lifelong condition.
Now, important to get an early diagnosis, of course.
Yes.
Why is it so important to get that? Because, I know there is hope. There are treatments.
Yeah, our treatments these days are so much better than they were even 10, certainly 20 years ago. And a newly diagnosed patient has a very, very good prognosis if we can treat early on to prevent the damage that's being done.
And I know you are looking for a cure. That's what you guys do, the research, and we appreciate all your work. And we appreciate you shedding light on this topic. Dr. Stark, thank you so much for being here today.
Oh, thank you so much.